Venous insufficiency is valves that are in the veins that keep blood from flowing backwards in the legs. When these valves get leaky, we get swelling and discoloration, wounds on the lower extremities that won't heal, and varicose veins. In the varicose vein, the veins are engorged with blood. When you have the venous reflux, the blood is allowed to flow backwards. When it flows backwards, the blood pools for a period of time, which causes the veins to have pressure and bulge outward. Varicose veins can cause pain in the legs, burning sensation, restlessness. Patients that are going to be at risk for varicose veins and venous reflux are going to be patients with the genetic predisposition for this, obesity, standing for extended periods of time, multiple pregnancies, lifting heavy weights. So we have a vascular ultrasound lab in our clinic where we're staffed and can add on tests. Typically, when we know what the patient's coming for, the test is ordered ahead of their visit, and then we see them following the test. The test looks at the vessels and can see how much backwards flow there is in the vein, or figure out if that is the problem causing their symptoms. Frontline for venous insufficiency and varicose veins is always compression. Traditional compression therapy is basically like a women's pantyhose. They come in a variety of lengths and sizes, from knee-high all the way up to a full-type pantyhose. They are more compressive than a traditional pantyhose. When you're putting on that pressure, it keeps those vessels from being able to bulge out and helps increase the pressure, decreases venous hypertension, and keeps the fluid inside the veins rather than leaking out into the extracellular space. Typically, when we evaluate a patient, we'll see them, we'll get them into some compression, we'll bring them back in 3 months, and then we'll evaluate whether it has been a successful treatment or not. At that point, we can turn around and decide what of the other interventions we have that are available would fit them. We have minimally invasive procedures like radiofrequency ablations. They're performed in the office. They make a small stick underneath the knee region, and they use radiofrequency to basically make that vein go away so that it can't leak anymore. The body has amazing compensatory mechanisms, so it pushes that blood flow back up through smaller veins that are not as leaky. We also have sclerotherapy, which is used for cosmetic procedures primarily. So that's going to be your patients more that have the spider veins on their legs or smaller bulging varicosities. That's also done in our office. We also have, for those bulging veins that are too large to get rid of, we have a procedure called phlebectomies. And phlebectomies is where we go in the operating room and make small incisions over the vessel and take them out. All of these procedures are minimally invasive, and most patients can return to work within a day or in a few days.